My name is DJ Bettencourt, and I have the pleasure of serving as the Deputy Commissioner of the New Hampshire Insurance Department. And I am very excited to share with you this morning what our department is doing to bring price transparency to our state's healthcare system. Everywhere you go in New Hampshire, citizens want to know how they can lower their healthcare costs. Additionally, consumers want to know how much those services are going to cost them before that care is received to help them decide where to go for that care. New Hampshire has been a long-time leader in making this information available to consumers and was the first state in the nation to launch a website that did exactly that when we launched Health Cost in 2015. I would be remiss if I didn't recognize that Tyler Brennan is here with us this morning. Tyler, for many years, was here at the department and was one of the founders of the Health Cost website, and I wanted to acknowledge his contribution to our department's efforts over the years. We believe that cost transparency lowers healthcare costs by enabling consumers to shop and compare medical and dental services. Fundamentally, it allows the consumer the opportunity to compare the estimated cost for certain healthcare services in and around New Hampshire. It turns the consumer into a consumer as they would for any other product. And I think that that's very, very important. Health Cost empowers consumers to know what they're likely to pay, but it also helps medical providers to compare their prices to their competitors. And that transparency, we believe, stimulates competition, which can help bring down healthcare costs. So it is a valuable tool for Grand Estaters across the board. Over the years, the New Hampshire Insurance Department has enhanced our efforts to bring price transparency, but others have caught on to our idea and have been doing work in this space as well. And to them, I say, welcome. Let's work together. Let's learn from one another so that we can put the best and most detailed information forward out to the consumer, because at the end of the day, that's what this is all about, getting the best result for the consumer. But again, I am excited to discuss what our department is doing to bring price transparency out to consumers, what we're bringing to the table. And to do that this morning is my colleague, Jason Aziz, who is our Director of Health Economics, Life and Health. So I'll turn it over to Dr. Aziz.
At the New Hampshire Insurance Department, we're very focused on price transparency, as DJ mentioned, and excited about its strong potential for impact on healthcare reform. I really look forward to advancing the work that Tyler Brannon had started here at the Insurance Department back in 2007 and continues to have a positive impact on New Hampshire citizens. My hope here today is to advance your understanding of the several domains of price transparency in healthcare. It works in several ways, each of which are very complex yet very interesting, especially to health economist geeks just like me and Tyler. For simplicity purposes, I have parsed this webinar out into 3 sections so that you can see how each segment responds to various price transparency mechanisms. These segments include supply side effects, how hospitals and providers' pricing behaviors are modified now that patients become aware of their prices, demand side effects, or how consumers, in healthcare we call them patients, how their behaviors are modified and they become more price sensitive because now accurate and timely price information is now available. In market-wide effects, how the healthcare market as a whole responds to the altered behaviors of all actors in the market. All right, let's get started. Have you ever noticed that purchasing healthcare is different compared to purchasing anything else in our lives? For most commodities that we buy, we have accurate and timely information about price and quality. Things have a price tag. Have you ever purchased a healthcare service that had a price tag? Well, neither have I. Meaningful price information is difficult for consumers to obtain prior to receiving care. As a result, rational choice, a core theory in the science of consumerism, is absent in the market for many healthcare services. And as such, consumers of healthcare are largely price insensitive. In response to this reality, healthcare reform efforts have acknowledged that price transparency can be an effective target for attenuating skyrocketing healthcare costs. The goal of laws targeting price transparency seek to reduce the price opacity to actors in the market. This affects consumers and producers and drives the market to evolve into one which is more sensitive to prices. Here I describe a theoretical framework underpinning price transparency and its effect on healthcare markets. Its reforming potential is actually a fascinating exercise in consumer-based economics. Its effect is mediated by the behavioral forces that can best be described by the Hawthorne effect, where behavior is modified by the awareness of being observed, and the Sentinel effect, where behavior is modified by the presence of increased oversight to actors in the market. You may be wondering why price awareness is so important. In normal markets where goods sold have a known price, consumers are said to be price sensitive, in which there is incentive to seek out lower cost substitutes. That relationship is depicted here in market supply and demand functions. Here, in a market classified as a perfect competition, you can see the relationship that supply and demand have on price and quantity produced. Notice the downward sloping demand curve that characterizes a reduced willingness to pay at higher prices. However, in the market for many healthcare services, consumers are largely insensitive to prices. The result? A vertical demand curve, where price makes little to no difference in quantity demanded. Notice that even when supply increases, price is unaffected. This is considered a form of market failure where the market does not function optimally. Okay, now that we've got that, I'd like to tell you something about price variation across various individual healthcare services. Here's an example of how widely costs can vary in our current system. This example was pulled right from New Hampshire Health Cost, the Granite State's flagship price transparency website. For this lab test, considered a shoppable service, the costs range from $33 to a whopping $564 statewide. That's a significant price variation. And it's very important to note that cost and quality do not correlate very well for most services. And importantly, most Americans seem unaware of this. Improving the awareness of both cost and quality can exert downward pressure on prices and, interestingly, upward pressure on quality among producers in the market. So I ask, are all healthcare services equally shoppable? Well, as you probably guessed it, maybe not. Do you price shop for healthcare services if you're having a heart attack or some urgent health crisis? Maybe not. But what about some important non-emergency care like radiology services, elective surgeries, lab services, and some expensive screening services such as colonoscopy? These are now considered to be some of the shoppable services that the Center for Medicare Services have identified in the sequelae of services that are part of legislation to get hospitals and insurers to post their prices for different services. In December of 2020, the federal government passed Consolidated Appropriations Act. This included price transparency laws that apply to insurers, hospitals, and even drug manufacturers. Whereas I'm not planning to review all of the legislation related to price transparency in healthcare, as a reference, this recording will be on our YouTube channel and we'll make this slide deck available to attendees after this webinar. I would like to take a second to talk about prescription drug price transparency, for which the New Hampshire Insurance Department is very active in this field. There are federal and state laws that seek to improve prescription drug price transparency. Several New Hampshire laws listed here target different entities. For example, 402N6 requires pharmacy benefit managers to file an annual report with the insurance department disclosing aggregate rebates from drug manufacturers. RSA 318 requires drug manufacturers to report new high-cost prescription drugs to the insurance commissioner. Consequently, each quarter, we update a drug dashboard on our website that communicates high-cost drugs, defined as drugs that have a wholesale acquisition cost that exceed the thresholds set for specialty drugs under Medicare Part D. In New Hampshire, RSA 126BB authorized the creation of the New Hampshire Prescription Drug Affordability Board, or the New Hampshire PDAB. These laws have made New Hampshire an innovator in prescription drug price transparency, and we look forward to see the reformative effect that it has on drug prices. To illustrate how the market responds to price transparency, I'd like you to consider the three domains mentioned before: demand side, supply side, and market-wide responses. To do this, it may be useful to assess each on its own, which is not necessarily how markets function in reality, but useful to learn some of the basic economics of price transparency. Once we get through this, hopefully interesting and painless lesson in microeconomics, I will share some empirical evidence of real change induced by price transparency right here in New Hampshire. Let's first examine demand-side effects, or how consumers respond to price transparency and price awareness. Again, we use our handy-dandy supply and vertical demand functions and their corresponding price and quantity relationships. Short and long-run responses to transparency may result in altered consumer behaviors for healthcare services, which looks like a leftward shift in the demand curve. Consequently, P moves to P prime, which is reflective of less consumers' willingness to pay high prices for healthcare services. Quantity demanded moves to Q prime, which reflects decreased demand for higher priced producers. These are both good innovations and helpful to consumers in the healthcare market. Now let's look at supply side effects, or how hospitals and providers respond to price transparency now that they know that they're being observed and overseen by regulators. We'll start by using our supply and demand functions, and to isolate supply side effects, I'll continue to use the vertical demand curve, holding constant the relationship between price and quantity demanded. In the long run, producers, or healthcare providers, modify their pricing behaviors, as no firm wants to be known as the most expensive in the market. So let's see what economic theory predicts might happen here. Let's imagine that firms begin lowering their prices. We might expect to see a rightward shift in the supply curve, and equilibrium prices decline. But quantity demanded may not change at first. This last effect rests on the assumption that demand for services is entirely based on medical necessity. I'd like you to consider whether or not you think this assumption holds true all of the time, or even most of the time. This is an important assumption that's a major factor driving the long-run effects of price transparency on healthcare markets. Okay, so now let's move to total market responses to price transparency. To try to quantify the benefit to our citizenry, we pull a page from our book on social welfare economics and seek to measure consumer surplus, defined as the actual price that consumers pay, which is below the price that they would otherwise be willing to pay. So let's turn back to our current market for healthcare services, and here's our supply in an inelastic vertical demand curve. Despite trying to identify an agreeable price, in reality, there is none. So the sky's the limit for the price that consumers would be willing to pay And we need to change that. So let's imagine that we're able to create price-sensitive consumers who are only willing to pay a certain maximum price for any given healthcare service. And over time, producers have become aware that people, including regulators who are overseeing their pricing behaviors, there's that sentinel effect, would result in a downward rightward shift in the supply curve. Remember that producers are responsible for market supply, so we see this downward price pressure on the supply side. Look what happens to consumer surplus. It gets bigger. To try to quantify this benefit to consumers, we can either quantify the absolute or relative value of consumer surplus. Let's see how it happens here on the left. You see the original size, the area of consumer surplus, and consumer surplus increases with these supply side responses to look like this. Now the next slide I'll show you empirical evidence of market-wide responses and price pressure that goes downward that's reflective of this green triangle, supply side only. I can only imagine the whole market-wide responses adding up the supply side and demand side, and then the market-wide shift in lower prices that price transparency as a whole can have over time to our healthcare industry. I'd like to share with you now an empirical perspective on some observations that we've seen helping real people in a real state like New Hampshire. This is a paper published in, I think, 2018 that demonstrated the long-term downward price pressure that price awareness had on certain pre-selected radiological services. Patient out-of-pocket prices decreased by 11% in the 4 years after being posted to New Hampshire health cost. This was a long-run effect, which became significant at 2 years, but ultimately resulted in a 5-year savings of almost $8 million on X-ray, CT scans, and MRIs alone. These represent major cost burdens to our current healthcare system, so I'm very optimistic what prospective savings might look like as more and more services get posted to New Hampshire health costs. Interestingly, this analysis controlled for demand side effects, meaning what you're looking at here was relegated entirely to supply side effects. So why does it take time for the market prices to respond? Well, here are a few important reasons. It costs money for hospitals and providers to change their prices. They have to negotiate with insurers, and they have to change their entire fee schedule. Additionally, it costs the consumer in the form of time, trouble, and money to learn about prices across the entire healthcare market that they can travel to. Price transparency legislation also seeks to reduce these barriers. Some of that federal legislation that requires hospital providers and insurers to have consumer-facing links and machine-readable files are examples of how legislation seeks to reduce these barriers, making it easier for consumers and regulators to access price information. This is good for all of us. This graph shows that it took a little bit of time for consumers in New Hampshire to become aware that price information was available. And once they did become aware as a population, you could see a big spike in the number of website searches for healthcare prices. So in summary, I'd like you to know and take home the concept of price transparency and that it has many incarnations. There are many examples in healthcare. One of them is the All Payers Claim Database. In New Hampshire, we call that New Hampshire CHIS. But there's also the hospital price transparency and coverage, which applies to insurers, and prescription drug price transparency, which applies to drug manufacturers and pharmacy benefit managers. Collectively, they all aim to reduce the price opacity in markets for healthcare services. Economic theory may be useful to predict how actors respond to these innovations. And empirical evidence exists, but more evaluation is necessary to drive future price transparency efforts. You can help by being a responsible consumer of healthcare. I thank you for your time, and I hope you learned something today.
At this point in time, Jason, we appreciate your presentation very much. We encourage folks to use the chat function to pose any questions that they may have. I don't see any yet. We'll give some folks just a second to type them in there. And of course, our subject matter experts are available at any time offline. You can reach us here at the department, and we can connect you to the right folks if you have questions about anything, price transparency or otherwise. Not seeing any questions. DJ, any final thoughts?
No, just thank you everyone for coming to the event today, and Dr. Aziz, fantastic work. Appreciate the detail and the time that you put into that presentation. As you know, this is a monthly webinar series, so we look forward to having you join us again next month. Andrew, what have we decided to highlight next month?
Next month, we'll be talking about insurance inventory and how to make sure you have your home and other belongings properly inventoried in case of an insurance emergency.
Wonderful. That sounds great. We'll do a little bit of P&C focus next month.
Mm-hmm.
I do see that some questions have come in, so I'll turn it back over to you, Andrew.
Wendy asks, are there any active marketing promotions to consumers by the department? And I think I can answer that. Yes, we have a consumer outreach coordinator, AJ Kierstead. He's here with us on the webinar with Dr. Aziz. And we're making consumer outreach really a focus of our communications unit here. We're doing everything we can to get out there into the community and talk to folks about all of the different kinds of insurance that we regulate. And a big part of that message is that we are here to help, right? Insurance is complex. It can be complex at times. We want folks to know we have a wide range of subject matter experts to help them with their questions. Our consumer team is standing by to take calls and emails from consumers with various issues, open up a case, and really go to bat for you. In terms of marketing specifically, we have made an effort to get out there this year at various Rotary clubs. We're trying to get into some chambers. We've been to some expos at some of the chambers. We're at the Fisher Cats game. We're doing radio promotions where we can get our subject matter experts on the air. So we're really taking outreach seriously and trying to do everything we can to let folks know that we're here, we exist, and we have a whole team of consumer services professionals ready to go to bat for you guys at any time. So don't hesitate to give us a call. Or to come by our website and file a complaint or give some more information that you might need. Andy asks, are the prices we see on the New Hampshire cost website bundled or just facility rates? Jason?
Okay, thank you, Andy. Good question. So when we have prices that are bundled, there's an indicator that communicates to the reader that they're bundled. And so we try to have services that are commonly provided with other ancillary services bundled when possible, but there's when it's reported like that, we indicate it as such. Yeah.
I hope that answers your questions. Michael has a question, related question to this subject. How does a consumer that shops on the site know if an out-of-network provider is unexpectedly used, i.e. an anesthesiologist?
Well, that's a good question. I mean, that was a central focus for the No Surprises Act, actually, right? So in-network versus out-of-network. And that's difficult to communicate because networks vary and we don't capture that information, all of that information. So that's one of the challenges and one of the biases to derive precise cost estimates. So the bundled services generally reflect narrow price variability, and in order to get up on New Hampshire health costs, if there's wide price dispersion, we generally censor those because they're not as useful to the consumers. So in-network versus out-of-network can be a challenge and methodological component to whether a price gets posted to New Hampshire health costs.
Yeah, and I would just add to that point that, in the case of the anesthesiologist, New Hampshire has had protections for consumers on our books since 2019. And then obviously the No Surprises Act came online at the beginning of 2022. So there are protections for consumers in those instances.
Matthew has a question. Where has the state published their machine readable files in accordance with the transparency and coverage rule?
So Matthew, those that legislation applies to insurance carriers. So if you go to the insurance carrier of interest website, those machine readable files are required to be posted to their website, and you can, as a member or just an interested member of the public, you can search the different health insurance plans and access those machine readable files and the consumer-friendly document, the consumer-friendly format of those rates there. The state isn't responsible for posting that information. The carriers and hospitals are required to.
Any other questions? Feel free to type them into the chat window. We've got a few more minutes and we'd love to continue the discussion with you guys. Mr. Bettencourt, can you explain those protections a bit further in relations on anesthesiologists?
Sure. One of the things that we advocated before the legislature for a long time is exactly the type of situation that you described. You're going in for a particular service. You're going in for some type of surgery. And you know that the referral has been made. You've got proper prior authorization. You're going to an in-network facility with an in-network doctor. And then what consumers are finding is, oh no, what is this bill that I'm getting? And then it turns out, well, sure, you went to an in-network facility, you had an in-network surgeon, but the anesthesiologist or the physician's assistant was not in network, and therein lied the bill. We were successful in finally convincing the legislature to stop that practice in 2018. And we said, if you're in network with the facility and the doctor, everything else is going to be covered as though it were in network. And if there is a disagreement between the provider and the carrier as to what the cost for that out-of-network individual services are, that is to be negotiated between those two parties, and the consumer is removed from that dispute.
So, Michael, we hope that answers your question. Seeing no other questions, I guess we will close at 11 here. We really appreciate you joining us for another continued episode of our webinar series. And as we mentioned, we'll be talking about insurance inventory. It's a property and casualty theme next month. So please stay tuned to your email for information on that. And again, this webinar will be available on our YouTube channel, and the slides will be available to attendees afterwards. So we very much appreciate your attendance and your attention, and we invite you to give us a call at any time if you have further questions or comments for us. Thank you very much.
Thank you.
Thank you.